Our last presentation is presented by Dr. Chang, Pei-Hung Chang. He is the attending physician and assistant professor at the Division of Hemo-Oncology, Department of Internal Medicine, Chang Memorial Hospital in Keelung. And today he is going to share with about nutrition care in patients with cancer. Dr. Chang, please.
Okay, thanks for Professor Jen's kindly introduction. I think I don't have much time to go through these topics, so I may make it quickly. So if you have any question, we can discuss private later. Okay, I'm glad I have this opportunity to discuss with you the issue nutrition care in patients with cancer. Oops. Okay. As we know, weight loss is quite common. Let's spend a few minutes getting to the meat of this problem. First of all, weight loss is quite common in patients with cancer, especially before or at the time of diagnosis, or either due to anti-cancer treatment. Okay, as we know, malnutrition is common. Here is an example. This study assesses cancer patients' nutritional status on their first oncology visit for care. It is from Italy study. As you can see, 65 patients had experienced unintentional weight loss during previous 6 months at the time of first medical oncology visit. It's quite high. And particularly in gastroesophagus cancer and the pancreatic cancer are the first two common sites suffer from unintentional weight loss. As expected, unintentional weight loss was greater in patients with, especially in metastatic cancer. But however, nutrition impairment even in early disease stage. 53 of patients without metastasis had already experienced weight loss as well. This study was conducted in Taipei Veteran General Hospital. The most two common cancer types that cause malnutrition were very similar in previous study, which are pancreas and gastric cancer. Here is another example in France. The result was also very similar. Pancreas and esophagus stomach cancer are the most two common cancer types that cause malnutrition. And this study also talk about this important issue that nutrition support is lacking worldwide. For example, 55% of patients had significantly reduced food intake, and 42% did not receive nutritional support, and 58% of patients did not receive nutritional counseling. Another survey in the US radiation oncologist show that nearly 2/3 of radiation oncologists did not receive formal nutritional education. Neither did I. So I think this is quite important. This paper published the reason what barrier prevent inclusion of nutrition practice on oncologist patient care. This reason I think are all excuse. No guideline, lack of knowledge, lack of time, unclear responsibility. I think all excuse. Okay. This is a very high impact journal, I think. Why nutrition is so important. Let's move on to my next points. This paper, they divide patients into 5 groups according to their body mass index and weight loss. And as you can see, this figure clearly tells the difference of survival situation. Okay. Malnutrition is also associated with poor outcome in oncology patients, including increased complication, reduced survival, and reduced quality of life. We can briefly discuss the etiology of weight loss in cancer. It is straightforward that tumor compression or obstructed bowels or GI tract and will reduce patients' food intake and may cause pain. Exocrine enzyme deficiency will cause malabsorption. Depression is another issue that will make patients unlikely to eat when they feel depressed, especially when they newly diagnosed with cancer. Treatment related, including any cancer, like chemotherapy or radiation related therapy side effect, will make patient suffer from weight loss. Another critical issue is metabolic change, especially in advanced cancer, which is abnormal cytokines production caused systemic inflammation. I think it's a key issue in the malnutrition about the systemic inflammation. That is often present in advanced cancer. It is result from pro-inflammatory cytokine released from tumor or immune cells. This inflammatory cytokine will cause anorexia, muscle wasting, and some metabolic change. And furthermore, weight loss, poor physical function, fatigue, and pain. So some patients may suffer from fatigue or pain. After well nutrition intervention, their fatigue improve much. This study talk about the prognostic role of malnutrition and the systemic response. As we expected, weight loss is a prognostic factor. But this inflammation biomarker, like GPS, is also predict survival. So we conduct GPS. It's very simple. We use CRP and albumin level to divide patients into 3 groups in our hospital, in head and neck cancer at our hospital. And it clearly predicts the recurrence-free survival and overall survival, which suggests inflammation was also involved in the malnutrition issue. So we need a parallel pathway to treat patients. Usually, as a medical oncology, we usually do disease staging and first-line therapy like surgery, radiation, or chemotherapy. Then we will do another evaluation like CT scan, and we will change our treatment plan. But at the same time, we can also do nutritional pathway. We can do nutrition assessment, screen, and give them some nutritional intervention. Then we should re-evaluation and consider up-level nutrition strategy. ISPN guideline give us some hint. First, we should screen and rescreen patients' nutritional status. How to screen? There are many screening tools like PGSGA or MUST score. MUST score, I think, is the simplest way to screen patients with malnutrition. They use very simple, like a body mass index, weight loss, and a nutritional intake in the past 5 days. If the patient score more than 2, we should do something to deal with their malnutrition issue. So this is also involved in our hospital. This is in Chinese form. As we know, our RNs has been very busy. So we set up a very simplest way to, in our hospital, use this MUST score. This is another system at our hospital. We screen every inpatient at time of admission. And the system will automatically notify dietitian if their MUST score more than 1. And the dietitian will do PGSGS evaluation and give necessary nutrition intervention as needed. I think Professor Chang knows this system. Okay. PGSGA is more complicated. It takes maybe 20 minutes for me to complete this form. So I think MUST score is the first step to screen patient, and we also use this data to predict patient's outcome. MUST score can predict major surgery complication in stage 3 gastric cancer. It's from Lincoln, Chang's data. PGSGA and MUST score also predict survival. This data haven't been published yet. Maybe it will be published this year. So ISPN guideline also talk about the importance of body composition. Let's take an example. These 2 people were very famous in Taiwan. It's a NBA basketball player, and this is a former candidate for Taipei city. And they have similar body height and body weight, but their appearance are totally different. So while we talk about body composition, sarcopenia has been involved in the diagnosis of cancer cachexia. Normally, physiologically, sarcopenia increase by age. Sarcopenia will cause loss of muscle function. Patients tend to fall, and they will decrease their quality of life. In cancer patients, sarcopenia predicts worse survival and progression-free survival, and some complication, toxicity response to chemotherapy. Here's an example. In patients with sarcopenia, their toxicity was higher when they received anti-cancer chemotherapy. How to diagnose the tool for muscle mass? DEXA and CT scan is CT scan is the gold standard, but it's quite inconvenient and it's expensive. DEXA is quite. We are doing this study to correlate with DEXA and CT scan. There are two studies at our hospital about colorectal cancer and head and neck cancer. The first study was published last year. Okay, as we know, every patient, colorectal patient will do CT scan to evaluate his cancer status. We use a specialized program to evaluate patients' paraspinal mass and the source muscle to evaluate their mass, and including quantity and quality. After chemotherapy, this is the same patient CT scan. After 3 months chemotherapy, their muscles quantity and quality decrease. And we divided this patient into 4 categories. And the progressive sarcopenia is a negative prognosis associated with overall survival and the progression-free survival. So Eastern guideline also suggests adequate energy intake, and the protein amount is very important. And we should decrease the carbohydrate percentage. This is a flyer at our oncology unit, a diet in oncology visit in our hospital. Key issue is decrease carbohydrates percentage. Okay. If patients' enteral nutrition is not adequate for this patient, we should up level, including supplementation of PN parental nutrition. This is a nutrition ladder, so you can eat. We do dietary counseling and oral supplements as needed. And if patient have the further nutrition issue, we should give enteral nutrition and the PN as needed. This is a study at our hospital regarding the head and neck cancer nutrition support. And we divide patients into 2 groups. First group, we do counseling, formula, and tube feeding. Control group is routine clinical practice. And patients with nutrition intervention, they can preserve their body weight and albumin level. And interesting, the toxicity of chemotherapy will reduce. And this is quite amazing. The 2-year survival was nearly double when patients receive nutritional intervention. So another key issue is inflammation biomarker, just we talked about. Because this tumor cell or immune response to tumor will abnormally conduct this inflammatory cytokine, and will cause the disaster of inflammation. And then will cause weight loss and furthermore cachexia. And so Eastern guidelines suggest us to do individual plan and some strategy to decrease the inflammation. And omega-3 fatty acid is the strategy to deal with the hyperinflammation issue. EPA, like fish oil formula, will help a patient. Omega-3 fatty acid in animal and cell line study also downregulate VEGF, so it may have anti-angiogenesis, so it may have anti-cancer effect. This study is we collaborate with National Ocean University in Taiwan It is my study. As you can see, when we give fish oil and specialized trace element, the tumor shrunk very obviously. So omega-3 supplements for patients in chemotherapy and radiation therapy, there are a lot of data. This is one commercial product. This study is in pancreatic cancer. Patients can preserve their weight and lean body mass. This is another commercial formula done in head and neck cancer. They also preserve patients' lean body mass. This is a third commercial formula containing omega-3 fatty acids and some micronutrients and probiotics. This phase 2 study was conducted in our hospital. And the preliminary result is patients with this specialized formula can preserve their body weight, especially in patients with body mass index less than 19. Okay, so this is a study we collaborate with UCLA to use further commercialized formula, including fish oil. The aim is to improve patients' body weight, and we also check very many inflammatory markers like TNF-alpha, CD4, CD8, and most importantly, circulating tumor cells. We hope this formula will have potential anti-cancer effect. So special consideration in cholangiocarcinoma, including the obstruction issue. So establish the enteral nutrition route is the key issue. So bypass surgery or stent as needed. And many will require the pancreatic enzyme replace therapy because of the pancreas star obstruction by tumor. So I'd like to leave you with one last idea. Cancer and anti-cancer treatment will cause malnutrition and furthermore, cancer cachexia, sarcopenia. If we do not deal with it, it will increase anti-cancer chemotherapy complication and poor survival. If we do appropriate nutrition therapy, it will maintain adequate body mass and improve nutrition status and possible enhance effect of anti-cancer treatment, better tolerance, improve the quality of life, and improve survival. Finally, I'd like to sum up the main points. Malnutrition is highly common in patients with cancer and independent predict toxicity and mortality risk. Sarcopenia, it is very important to evaluate this issue, and it also predicts cancer progression. Timely appropriate time model, including some specialized oral nutrition supplement, it will improve treatment tolerance and outcome in patients with cancer. This is the end of my talk. Thank you for listening, and I hope you enjoy my talk. Thank you very much.